My name is Christopher Charles Sermon. I go by KC Sermon. So usually people are not coming to see me because they're happy about something. So my philosophy in treating patients is not only to make their day better, but also to get them in a timely manner. You know, I want to get them in as soon as possible to treat their injury.
When I'm dealing with a patient, my main focus is just to listen to the patient. 99 times out of 100, if you sit down and talk to somebody, they'll tell you what's wrong without you having to ever put your hands on them. I try to listen to the patients and let them tell me as much about their problem as they can before I start doing my examination.
My name is Paul Novakovich, and I'm an orthopedic surgeon here in Ruston. I try not to take the cookie cutter approach to medicine. I don't want, when a patient comes in, for them to think that they're just a number on the schedule for that day. I want them to feel like I've listened to what their complaint is, I kind of understand what they're here for, and then take into account all of their sort of factors.
The patient needs to be involved in their care. The physician and surgeon should be talk with them about their situation and educating them, but then give them options and have them decide how best to manage it. What I'd like for them to feel when they walk in the door is that someone actually cares about them. We really want to see them do well. When you walk into a place and you're greeted well by someone who is concerned about you, that just sets the tone for the rest of your visit.
My name is Stanley Crawford. I'm a board-certified orthopedic surgeon here in Monroe, Louisiana, and did my spine fellowship training at Sonoran Spine Center in Phoenix, Arizona. I think that it's very important that as a doctor that the patient understands what the treatment goal is and that they have a say in their treatment. I never tell people they have to have surgery. I always tell them that surgery is an option and that we can discuss about the option of surgery and that they understand what treatment options are available to them.
I want to take good care of people. I want to be kind to people and just find out what their needs are. I want to make sure I get to know them and listen to what's wrong with them. And obviously the most important thing is to get them back to feeling better. I mean, they come to us because they're hurting and because they can't do things that they want to do. And so I think the most important thing is that we get them to be out of pain.
My name is Cameron Best, and I'm an upper extremity orthopedic surgeon. At the end of the day, I just want to take the best possible care I can of my patients. What that means to me is, first and foremost, I need to listen to my patients. If I just allow them to tell me the story, they will tell me what's wrong. Taking the best possible care of patients is my philosophy. I'm not in it for me, but I'm in it for them.
My philosophy about patient care is to really be patient-directed. What are their expectations? What do they want to do? I like to see how aggressively I can get the person back, either to their daily activities, to a sport, or to just a hobby. Most important to me about a patient experience is to, when they leave, is to they feel like they've been heard and they have no questions about what's going to go on. And if they do have questions, they're not afraid to come back and ask me.
I'm Grant Dona. I'm an orthopedic surgeon. Even after doing this for 30 years, I have to keep reminding myself that it isn't just about figuring out the problem and coming up with a plan, but figuring out what the person's really wanting out of their doctor visit that day.
When I got to medical school, I just fell in love with it. I like coming to work. You get that take-home joy in seeing somebody that came in a wheelchair and at one of their post-op visits walk in the door.
I'm a big proponent for patient autonomy, to bringing people in to be their partner versus telling them exactly what to do. And it's really important to me to kind of educate my patients about other things other than just orthopedics and kind of make lifestyle modifications, really get people feeling better than they've ever felt before.